At AGBU's headquarters in Manhattan took place an important event titled On Frontlines of Health, organized in collaboration between APRI, Applied Policy Research Institute Armenia, AGBU, and AAHPO. Natalie Gabrielian, Director of Chapters and Central Board Administration of AGBU, welcomed everyone and spoke about the mission of APRI think tank. She introduced the two speakers of the event, Dr. Kim Hekimian, Senior Fellow of Public Health, APRI Armenia, and Dr. Lena Nanushian, the First Deputy Minister of Health of Republic of Armenia. Dr. Kim Hekimian spoke about the health effects the blockade, the war, the forceful deportation had on the refugees from Artsakh, mainly focusing on nutrition and malnutrition, especially in pregnant and nursing women.
There are intergenerational consequences from undernutrition. So we know that a woman who is undernourished during pregnancy can give birth to an infant that has health issues as a result, again, of this undernutrition, and that child, if the child continues to be malnourished, will have a lifetime of risks for disease that they can take in with them, and as if they are female infants, they can take with them for the next generation through their pregnancy, because they're going to walk into a pregnancy having not had a full tank of the nutrients that they need for optimal fetal growth. During the first trimester, those first 12 weeks of fetal development, if a woman doesn't have the essential nutrients that she needs, we do see that there is a higher risk for poor infant health outcomes. And so as we're thinking about the refugee population, we want to think always when we're doing screenings and thinking, we want to see, were they pregnant during the blockade? And did they suffer from food insecurity during their first trimester in particular? And if so, there are things that we can do if we correctly assess them and screen them. There are things we can do to reduce risk for poor fetal development. The issues of infant health and infant nutrition are also particularly important in this blockaded wartime environment because about 50% of women in Artsakh, just like in Armenia, they feed their infants mixed with breastfeeding and infant formula. But the problem with infant formula is that we develop a dependency on infant formula that then in Armenia, because of the blockade, there was a very intermittent supply. And so we, in our field, like to promote exclusive breastfeeding because it provides optimal nutrition to the infant, it has health benefits for the mother, and it decreases our dependency on infant formula.
She concluded with the question of what we need immediately as an emergency relief for the Armenian refugees from Artsakh, including access to mental health, providing nutrition to women escaping war, and providing cash vouchers for people to care for their medical needs and more.
Well, the immediate needs, of course, shelter, food, medicines, vaccines, and mental and physical health services. There's an intra-ministerial working group that is putting this together with the SUNYK Mars administration, but we know that there needs to be coordination not just from ministries and Marzer, but the UN agencies, particularly the World Food Program, who I know the government has requested support for, and they are going to be supporting with food, and other non-governmental organizations, which include all of our diaspora non-governmental organizations. In order to have coordination, we need good communications. And that's something that was really lacking during the war, and we learned a lot of lessons from that, but I'm not sure that we're at a state right now where we can really improve those, but I know people are working on them. We also need health education communication to people to describe why it is that we are suggesting certain foods, or why it is that we are suggesting that they get a vaccine booster or something like that. The near-term needs, there's a lot of evidence that shows that cash vouchers through an EBT card or through an Apple Pay, something is better at providing mental health support, dignity, autonomy, agency, decision-making at the level of the family. So the family decides how they want to use that money, on which food, on which clothing, if they want to use that to leave the country, if they want to use that to stay in the country. That will be something that the evidence shows clearly helps with the mental health and traumatic outcomes from what the people in Artsakh are experiencing today. And I really hope that this is something that we move towards and move away from humanitarian product dumping for too long. We need it immediately, but we should move away from that. And then long-term needs are really about economic, social, and psychological support that they're going to need for a lifetime and for multiple generations.
Dr. Lena Nanushian, First Deputy Minister of Health of Republic of Armenia, who was in New York to participate in high-level meeting in UN on health policy, began her presentation by describing the dire healthcare challenges of Armenians still in Artsakh and for those refugees fleeing the Armenia.
Due to blockade that's continued already more than 10 months, we have many challenges connected with the provision of healthcare services. Provision of, first of all, medicine, because there was a shortage of medicine, mainly for chronic diseases. We have a shortage for vaccines. We have overwhelmed hospitals in Artsakh, and sometimes it was very hard for us to negotiate and bring through ICRC patients who were in severe status in Artsakh, and when we were already bringing them, it might sometimes be late for them because some other problems were arising. Of course, other issues like absence of fuel, electricity, etc., all these issues are affecting the provision of healthcare services in Artsakh. So if there is no fuel, then the ambulances are not working. If there is no electricity, then the urgent care cannot be provided. So I'm just bringing a few examples how was life in Artsakh during last several months.
She then changed the topic and spoke about the major reforms underway in Armenia to provide universal health care to all citizens. She discussed several aspects of this reform, including testing equipment, availability of medicine, healthcare facility conditions, and more.
But there are many important points in this universal health insurance system. First of all, the package of screenings in the package of insurance. So we have listed several screenings in the package. Now we are in a process of identifying if the healthcare system of Armenia is ready to implement and to provide all these screenings, because one thing that you think that okay, these are those right screening project that should be placed in Armenia, but when you are coming and seeing that healthcare system, there is no any equipment or only one mammography that can do at least 700, for example, exams per year. It means that the woman, the age with those age that should be targeted will not be able or will not have access to that mammography services as well. Another important part of this reform is the package of medicines. So we have designed a list of medicine that should be available at the primary healthcare level. Usually people are not applying to primary healthcare. You have might heard about primary healthcare in Armenia. These are the polyclinics, ambulatories, and health posts in villages. So people are not applying for services because of several factors. First of all, they are not satisfied with the quality. You can enter the building, see how old are they, no equipment, are not friendly. People are not satisfied with the knowledge and skills of healthcare staff that is working there. but also if they're applying to, let's say, polyclinic or primary healthcare setting, and the disease is diagnosed and they are not receiving all of those medicine that they should receive.
She also discussed the overall quality of healthcare in Armenia and the promotion of healthy lifestyle.
We should somehow change the culture of quality in our medical centers. And to change that culture, we thought that it will be helpful, first of all, teach people about the quality, develop a training program, then have these accreditation components piloting, basic ones. For example, we have included mandatory patient satisfaction survey, incidence registry system, quality indicators that should be collected, hand hygiene project, and all these are components of the quality program that we are going to test next year. And here we have again diaspora professionals engaged. The government is building and renovating numerous of sport facilities across country. Besides kindergartens, schools, hospitals, ambulatories, polyclinics, numerous of sport facilities are built now across country. And we are trying with that to somehow promote the physical activity. Unfortunately, every fourth of our 7-year kid, 7-8-year kid is having overweight. So this is huge for us, and this is a warning for us, and that's why we have started to work on that. I have forgotten about tobacco taxes that we have increased, but also now we are working with the Ministry of Finance to set up sugar taxes on sweetened beverages, which is also a tool to respond for obesity issues.
The event concluded with Q&A with the audience who had many pressing and important questions.